Here's what to expect when you arrive at the hospital for an induction of labor. So first you will be escorted into either triage or a patient room based on your hospital's availability and your provider's preference. You'll be asked to change into a gown, and then most likely your nurse will put you on the monitor to see how the baby is doing for about 20 minutes. This is called an NST. And then they'll take your vitals like your blood pressure and your temperature and heart rate. Some inductions you can go home after they've done something at the hospital. Other inductions you have to wait around and decide if you should be admitted to the hospital or not. So usually they'll check your cervix. So the OB will come in and check your cervix to kind of check your cervical dilation and see what method of induction would best suit you and your situation. So the first method of induction is called a Foley catheter induction, and it's basically a balloon that sits inside and acts as the baby's head to help mechanically dilate your cervix. Another method of induction is oxytocin. So this one is done for sure in hospital. You have to stay, an IV is started, and the nurse will slowly monitor and increase your oxytocin levels. This helps to create uterine contractions. So it's not a mechanical method of induction, it's a medication that they use. So sometimes they can use oxytocin and the Foley catheter at the same time. Another method is called Cervidil. This one is a prostaglandin, which basically means it's something that helps to ripen the cervix. So it's like a tampon that they put inside of your vagina, and it will stay there for 12 to 24 hours, and it usually starts contractions on its own. So sometimes they will give it to you and send you home and say, come back if you're getting a lot of contractions or if your water breaks or anything like that. Another method of induction that's used as well, that's a medication, is called misoprostol, and it can be taken orally or inserted through the vagina. I have only had experience using this in the hospital setting, so you would be admitted for the use of misoprostol, and this helps to create uterine contractions as well. So there's lots of different methods. Sometimes they'll also break your water, depending on how dilated you are and how low the baby's head is. They choose the method that is safest for you and your baby.